and then I'll post this on Blackboard, or not Blackboard, YouTube. All right, so I'm going to start with question 6. And then if I move along and if I pass a number, then we'll go through there. So 6 hopefully is a review for you guys. This is what you've been doing first and second semester. Now you're in third semester. It almost feels old hat. So always remember when you're doing this question. So first of all, I already know that the sheet which you guys have, I know it doesn't show up so great while I'm doing these reviews. So I was trying to fuss with the camera to kind of get it to work out a little bit better and be a little bit cleaner. And that's just not the case. So I do apologize for that. But what I write with the Sharpie here on paper, it should come out just fine. And then also there shouldn't be any lag, which is also a good thing. So number 6 says that you have Aldamet as labeled below. So you can see the label says 250 milligrams per 5 ml. So that's the strength. Okay. And the order is 400 milligrams PO/TID. How many milliliters will you give per dose? So for simplicity's sake, I know that there's multiple ways to solve these problems. For this review, I will be doing dimensional analysis setups, but if you do desired over have, you're going to get to the same thing that I'm getting to. Just make sure that we're getting the same answers, and then you'll know that you're setting it up correctly. So the order is 400 milligrams. Okay. I want to know how many milliliters to administer per dose. And then what I have available is 250 milligram per 5 ml. Okay. So I'm going to take the 400 times 5, which I believe is 2,000, and divide that by 250. And I'll get 8 milliliters. Now, the variation on this question and something to pay attention to is sometimes this question gets asked, how many teaspoons will you give per dose? Or how many tablespoons will you give per dose? Just make sure you know to convert milliliters to tablespoons or teaspoons if it gets asked that way, okay? I don't think that for your semester it'll get asked that, but if it does, just make sure you pay attention to that. All right, the next number was...
Sorry, excuse me. Can
Yes.
I ask you something?
Yeah.
Yeah, remember in the question 6, it has so your patient is ordered the Aldamet 400 mg PO/TID. Are we going to ignore the TID there?
No, we're not ignoring it. We just don't need it to solve the question. If it asked me how many to calculate how much to give per day, then I would account for the TID. But all I'm going to do is give 8 milliliters 3 times a day. So when it says per dose, all you calculate is the per dose.
Okay.
Yeah, very good question. Yeah, whether it's BID, TID, QID, what's important is a lot of times, if you think about it, like imagine you're a practicing nurse, you're in the hospital setting. Even when you're overworked and underpaid, you usually are only doing a 10 to 12 hour shift, and you probably are not going to see them for all the doses that they're going to take. You just need to make sure that you're administering the correct dose at the time that you're administering that dose. That's just the way I try and wrap my head around, and maybe that helps you guys out too.
Okay, thank you.
You're welcome. Okay, so the next question is question 13. Just trying to... Okay. So this is a question that's somewhat disguised as a weight-based question, but it's not. It's just the patient's weight is there, but you don't need it to calculate what you're administering. So it says dexamethasone sodium phosphate 5 milligrams intramuscular every 12 hours. The patient weighs 127 pounds and the strength in the vial is 4 milligrams per milliliter. You will give blank milliliters. Now, when you're calculating this, I know it says every 12 hours. If it doesn't say per day, you can assume that the question is asking per dose, because what are you going to do right now? Not what you're going to do now and then later. What are you going to do right now? You're not going to set your syringe up for the day's worth or set up 2 syringes and then wait 12 hours to administer, especially if you have something that's supposed to stay like, refrigerated or something along those lines. So if it doesn't tell you specifically per dose or per day, you can assume that it's per dose. Okay. If it does say per day, then you calculate per day. And usually on the test, that's been sifted out. And so it should say per dose, but just in case it doesn't. Okay. So the order is 5 milligrams. What we have available is the 4 milligrams per milliliter. So I don't want milligrams, I want milliliters. And you just do 5 divided by 4. 5 divided by 4 will give you 1.25. Now, because your rounding rules say that any number greater than 1, you round to the nearest tenth, you're then going to go ahead and round this number to 1.3 milliliters. Now, what if you have a syringe that goes down to the hundredth place? Can you administer 1.25 milliliters? And the answer to that is yes. So you always be as accurate and specific as possible. When we're on the, we're taking the drug calc test, it's one of the things that they're testing you on is just your ability to make sure you know how to round when rounding is presented to you, if that's what you have to do on a given scenario. Because if you don't have a syringe that measures 1.25, you have to give the closest equivalent, or you go pick another syringe, which is probably the more accurate answer. Okay, so that's 13.
So let me ask you something again. So in this case, the weight doesn't matter anything in this calculation.
Correct.
Okay. So in what scenario do we have to calculate the weight before we proceed?
So if the question asks you to calculate like a dose base, and then the it tells you like milligrams per kilogram, then you would factor in the weight. You would convert the patient's weight from pounds to kilograms and then multiply the kilograms by that factor, which is milligrams per kilogram. So if you see per kilogram, that tells you it's a weight-based question and you need to account for the patient's weight.
Okay.
Good question. Okay. 16. Oh yeah, let me add 19 on here. All right. Okay, good. So 16 is your flow rate type question, your drops per minute. So one of the things before I get into answering this question, in order to calculate a drop rate question, you need to know 2 pieces of information. You need to know the flow rate. You need to know the drop factor. And that will give you the drop rate, which is in drops per minute. Okay. So number 16 says that the tubing on the package is labeled as shown. So you can see here that number 15, it tells you, and then if you zoom in or look at your own practice sheet, 15 drops per milliliter is what that says. So that's your drop factor. Okay. At CCAC Allegheny, your drop factor will always be given to you. If you're at another campus, a lot of times they'll ask you and not give you the drop factor. And a lot of times they'll use micro tubing as the tubing in question. And that's typically 60 drops per milliliter. So 60 drops per milliliter. But if you're here at Allegheny campus, then your question will be, you'll have your drop factor will be given to you either as a label, like as shown here, or it'll be in the question itself. Okay. So it says you're ordered to administer the dextrose 5% water IV solution at a rate of 75 milliliters in 25 minutes. So there's your flow rate, 75 milliliters, 25 minutes. Hope if I show you guys that. We already identified the drop factor, which was the 15 drops per milliliter, because that was given. It was written in the notes, written in the on the label. Okay, and now all we got to do is the math. Okay, we've eliminated milliliters. We're left with what we're looking for, drops per minute. Okay, and then we will get, when you do the math, you'll get 45 drops per minute. Now, one thing I want to mention, and something I'll advocate here, I told you already beforehand that I was going to do the dimensional analysis setups. You can do most other questions. You can do the desired over have, or the ordered over have setups times quantity. With your flow rate and your drop rate questions, it's harder to do that. You can. It's just that what you would instinctively put as your quantity and where things go, you might get a little bit confused unless you're doing it consistently. So if you are setting this up differently, but getting the right answers, you're not doing it wrong. Okay. We're just doing it differently. So there's the nice thing about math, or sometimes the frustrating thing about math, is there's more than one way to get to the same answer. And there's nothing wrong with doing that. Just show your work. And if you have a question about how you're setting it up, you can email me a screenshot and I can tell you, yeah, this looks good, or you can ask those questions. But this is how you would set up a flow rate. All drop rate questions look exactly like this. You'll have a flow rate. Sometimes it's milliliters per minute. Sometimes it's milliliters per hour. If it's per hour, you convert hours to minutes. Okay. You'll be always given the drop factor, and then your answer will always be in drops per minute. All right. 19 was also asked. Okay, good. So this is another, this is a flow rate question. Believe it or not, number 19 is actually missed a lot. And the reason it's missed a lot is because there's really not any specific math to do. It's just reducing volume over time. Okay. So again, I know that it's hard to read, but it says the patient is to receive 375 milliliters of Ringer's lactate. So 375 milliliters of Ringer's lactate over 3 hours. It even tells you how to put it together. Okay. And then what would you set the rate on the infusion pump to in milliliters per hour? So all you're going to do is reduce your milliliters per hour. So 3 goes into 375, 125 milliliters per hour. So technically there's no math involved with this question. It's just reducing from milliliters per 3 hours to milliliters per hour. Okay. And all I did was 375 divided by 3. So I guess there is some math there. All right. Oh, I skipped 15. I'm sorry. Let me go back. Oh, 15. What I'm going to do is in the OneDrive link that I shared with you guys at the beginning of this, and if you didn't get it, just ask somebody to copy and paste it back into the chat. There's this image. This image shows you how to mark the syringe for these questions, such as 15. And the way you're going to mark the syringe is you're going to put a mark at the total. So in this instance, it says 10 units regular and then 30 units Humulin N. On your practice, I think it says 10 units regular and 40 units NPH. It's the same thing. You're going to make a mark at the total. So for this example, the total is 40 units. And then the 10 units regular insulin, notice, is between 30 and 40. Okay. That's this first little like wavy line here. And then the remainder is the Humulin N. This is how they want you to mark it. This is how they want you to mark the syringe. Thank you for reposting that. So this is how they want you to mark the syringe. I worked this out earlier, and I'll show you like my terrible drawing skills. And then I'll tell you how I would recommend marking the syringe. Give me 1 second. Thought I had it here. Maybe I don't. Oh, here we go. It's on the back. So when you're marking the syringe, this is your example. So first of all, it's always B. It's always option B because I don't have any other images for which syringe to choose. So make sure you mark the syringe you're going to use. It's the one that says units. Then I would say make sure you mark the total. So make sure you have an arrow at the total. So in this example, it's 50 units. And then I would write next to the question where it says solution and amount to be drawn up first, I would write 10 units regular insulin. And then what I displayed here is, here's the mark at 40 units, here's the mark at 50 units, and that's where I would put my 2 marks indicating the total amount and then where the regular insulin would be. And notice I created these lines here to indicate this is where the regular insulin would be drawn up first, and then the NPH would be drawn up second. Okay. Review the image that I shared on the Google Drive, or I'm sorry, the Microsoft OneDrive, and that should help clarify. And then I would just get clarification from your lab instructor of how they want the syringe to be marked. And you should be able to just email them and ask them that question. They get asked it every semester, I promise you, because I tell everybody every semester to ask their lab instructor because they're the ones grading it, not me. Okay, so that was 15. All right, now into the questions in the 20s. I'm gonna get a new piece of paper here. All right, 21. 21, if you remember, this is the same question that you were asked about last semester. This 21 has some extra information that you don't need to worry about. Remember, when you're doing these calculations, the milliliters diluent added, that just means how much water is being added to the powdered medication to get to the desired concentration. So you have 3 concentrations listed in units per milliliter solution. So you have 250,000, 500,000, and then 1 million. What you're going to do is it tells you to administer, or you're going to calculate based off of the strongest concentration. The strongest concentration is the one that's going to give you the most units per milliliter, and that's going to be the 1 million units per milliliter. So your order is 350 units, 350,000 units. Times, we don't want units, we want milliliters, and that's the 1 million per milliliter. Okay. Now, sometimes when you're plugging this all into your calculator, there's a whole lot of zeros there and some room for error. So what I usually do is I look at the number that has the least amount of zeros. So there's 4 here, and I'm going to eliminate 4 at the top and 4 at the bottom. So 35 divided by 100, you're less likely to make the mistake plugging that into your calculator. When you do, you'll get your answer is 0.35 milliliters. Now, you do not round this number to the nearest tenth. Why? Because numbers less than 1, so 0 point anything, you would round to the nearest 100th place. Okay. Now there's no number past it, so you don't need to do any rounding. Your answer would just be the 0.35 milliliters. Okay. If you look at the beginning of the packet and it tells you about the rounding rules, it does explain that, a number is greater than 1, round to the nearest tenth. Numbers less than 1, round to the nearest 100th. And then unless there's no number to round to, then you don't need to worry about any rounding. So that's 21. All right, 22. Okay, So 22, this is actually a little bit different than some of the infusion rate questions that you were seeing before. But I put 21, or I put 22, 23, and 24 before 25 on purpose, because if you can do 22, 23, and 24, then you can actually do the main part of the heparin protocol, which is number 25, which is what we're working up towards. So let's go ahead and do these. So 25 says the order is 0.45% normal saline, 1,000 milliliter IV with heparin 25,000 units to infuse at 1,000 units per hour. Calculate the flow rate in milliliters per hour. Okay, so we have a flow rate given, and it's 1,000 units per hour. But I don't want units, I want milliliters, right? So there's a couple of ways you can set this up. Okay, now I've potentially have already trained you to start with flow rate, and the given flow rate at this point is the 1,000 units per hour. Remember, units is just a measurement, and in this instance, it's a liquid measurement, so it's volume over time. Okay, so 1,000 units per hour is the given flow rate, but I don't want that. I want milliliters per hour. That's okay. Is there a way to go from units per hour to milliliters per hour? Well, yes. Given the information we have, we can do that, and really just comes down to, this is where dimensional analysis, and at least practicing it and getting decent at using dimensional analysis, will pay off, because what you're going to do is you're going to ask yourself, well, what am I wanting to get rid of? Units. What do I want to keep or transfer to? Milliliters. And then, do I have anything that could connect milliliter and units? And the answer is yeah. You have 1,000 milliliters of 0.45% normal saline, and inside of that 1,000 milliliters of 0.45% normal saline, you have 25,000 units of heparin. They're together. It's a mixed bag. Okay, it's your drink. It's your bottle of Gatorade. You can't separate the sugar from the water. It's all mixed in there together. So that's where the 25,000 units comes from, and then the 1,000 milliliters. Okay. Now, all I'm going to do is do 1,000 times 1,000 and then divide it by 25,000, and now I'll actually get my milliliters per hour. And then before I do anything, I already know I'm doing it right, because when I look at what's left, milliliters per hour, I already know that I set up this question correctly, and I'm going to get the right answer before I do anything. The only thing that would make a snafu is if you plugged it into your calculator incorrectly, which can happen. So always double check your work. So 1,000 times 1,000 is going to equal 1 million, and then divided by 25,000, and you'll get an answer of 40 milliliters per hour. So if I want to infuse 1,000 units of heparin per hour, I need to set the infusion pump to 40 milliliters per hour. Now, you guys will know this better than I do. When you're doing your clinical rounds and you're in the hospital setting, I don't know that the infusion pump can be set to units per hour, but I have seen them set to milliliters per hour. Okay, so there might be specific, infusion pumps that can be set to different things like units, cc's, drops, and things like that. Well, I assume drops because you do calculate drops per minute. But it may, if it doesn't have it as units per hour, you need to know how to convert that to milliliters per hour. So that's exactly what you do in question 22. So all we did was convert units per hour to milliliters per hour. Well, that was a heparin question. We can do the same thing and follow the exact same strategy doing insulin. Okay, so let's see how we would set up insulin. Insulin, in this instance, it tells us 0.9% normal sodium chloride 500 milliliters IV with Humulin R regular U100 insulin 500 units to infuse at 10 units per hour. So I'm going to start this question the exact same way I started the heparin question. I'm going to take the initial flow rate, 10 units per hour. I'm going to ask myself, can I convert units to milliliters? Do I have a way to do that? And I do. I have 500 milliliters of IV, and inside that 500 milliliters of IV is the 500 units of insulin. Okay. Do I want units? No, I want to get rid of those. Do I want milliliters? Yes. Okay. Oh, sorry. And then 500 units, 500 milliliters. Okay. And then you can see here that these cross each other out. I'm done with units. I'm left with what I'm looking for, which is milliliters per hour. And what I'm going to get is 10 milliliters per hour. So if you got the same thing and you were like, wait a second, is this right? You did it right. Don't doubt yourself. If you got the same thing, 10 units per hour is the same thing as 10 milliliters per hour. That all has to do with, it's all relative to how many units you're infusing and then what volume of liquid it's in. And that's why you got the same answer. All right, so that was 23. And then 24, we're going to take a step away from the Heparin protocol practice. And this is just a, can you calculate the day in which we start and the day, and then the time and day that we start and the time and day that we end based off of an infusion pump running. So it tells you we have half normal saline, 1,000 milliliter IV running at 50 milliliters per hour. If the IV were to start at 8 a.m. on Monday, what time of day will it finish? So I'm going to break my own protocol and I'm going to start off with my initial volume. So I know I have 1,000 milliliters. Okay. And I want to know basically how long it's going to take for that 1,000 milliliter IV bag to be done. So we know that it's infusing at 50 milliliters per hour, but what I'm looking for in this question is how many hours. Okay. So all I'm going to do is I'm going to flip what I had, my 50 milliliters per hour. I'm just going to flip that ratio in order to calculate how long it would take. Some of you instinctively were like, well, I would just take 1,000 divided by 50. And that will tell me how many hours that 1,000 milliliters will be up if every hour 50 milliliters goes away. Now, if I do this correctly, I believe the answer to this is 20 hours. Okay. And then I'm going to double check. Yep, 20 hours. Okay. Now, the second part of this question is, didn't ask you how long it was running. They want to know at what time will it finish. So it started Monday at 8 a.m. And we want to know, when does it finish? Okay. So here's how I rationalize this. And you can use this strategy if you want, or if you have another strategy, that's perfectly fine. In 24 hours, okay, it will be Tuesday at 8 a.m. Does that make sense? So in 24 hours from Monday at 8 a.m., it'll be Tuesday at 8 a.m. Okay. So subtract 4 hours. And my answer is Tuesday at 4 a.m. Okay. Now they may want you to write that in military time and you'd have to write it as 0400 or whatever the case may be. That has not been, clearly spelled out to me, but I can tell you that if it started Monday at 8 a.m., it will finish Tuesday at 4 a.m. Or the real answer to this question is it'll finish when the alarm goes off, right? It starts beeping and it tells you that it's almost out. That's when you know when to change it. But as far as calculating this would be your answer. Okay. All right. So the next thing is the last one is the doozy, which is the Heparin Protocol. And I know that this is a beast of a question, but my hope is that once I show it to you, you'll be like, oh, that wasn't so bad. I just didn't know what to do with the information that was in front of me. And that's typically how that question goes. So what I'm going to do is flip it to the back. And we're going to go through our heparin protocol. So before I do anything, basically everything that you see from here down to answer the following questions, this is all considered the protocol, okay? So if you do a Google search for heparin protocol, you're going to see all of what is listed here, okay? So this is not something that like I created or CCAC created. This is just the protocol. It tells you what to do after you calculate a patient's weight, and you're going to go through and you're going to follow the protocol. Now, some of the protocol you're not going to be doing for the dosage calc portions of it, such as you're not going to worry about filling in the CBC and how often that should be done. You don't need to worry about the GAIA-X stool. You don't need to worry about the neuro checks. You don't need to fill in the protocol. You just need to know how to get information from the protocol to answer the questions below. So the only thing you're focusing on is answering the questions that are below, which are A, calculate the number of milliliters to be administered for the bolus. B, calculate the infusion rate in milliliters per hour for the heparin IV drip. And then C, after 6 hours, you're going to assess the patient. And in this assessment, the APTT is 43 seconds. And then you're going to recalculate the new bolus and recalculate the new infusion rate. Now, on the actual test, you will only be given either A and B or C1, 2. Okay. So you're only going to get 2 questions on this. You need to get both questions right to get full credit. But if you miss both questions or miss one of the questions, you've only missed one. Okay. So this doesn't count as 2 questions if you happen to miss it. It's just that there's 2 questions. They want you to be able to calculate the bolus, and they want you to be able to calculate the infusion rate based off of these questions down here. And like I said, you'll either get just A and B or just C. So you won't have all 4 questions. I'm giving you all 4 questions because I wanted to give you extra practice when you did this thing. The other thing is, the only thing that can really change in this question is the patient's weight, the initial weight. So you'll see that on your test, you'll have a different weight. And then whatever the APTT is, that could change as well. Okay. So those are the only things that really could change. Everything else that I'm going to show you in just a moment is fairly standard for the protocol. And as long as you follow it, you'll be okay. So I want to highlight a couple of areas that are really, really important. So if you have this in front of you, I would suggest like either highlighting or starring or putting a pencil mark or pen mark next to what I'm going to be showing you next, because this will help you out with understanding how to solve this problem and where the information comes from. When I initially looked at this, I wasn't quite sure what to do with it. And then I did what, what CCAC pays me to do, and I figured it out so that I can show you guys how to figure it out. Okay. So the first thing is, you're always going to calculate the patient's weight. It's going to be given in pounds. You're going to calculate it into kilograms. So you do need to complete step 1 of the protocol. Okay. Step 2 of the protocol is actually where you get the information to answer part A and part B. Part A wants you to calculate the bolus dose. Okay. And it tells you bolus dosage strength, 1,000 units per milliliter. So it tells you the bolus dosage strength. Also, you need to calculate the infusion rate. Infusion rate, 25,000 units and 250 milliliters of half normal saline. So now you know how to calculate the infusion rate, because with the infusion rate, we need to know how to get to milliliters per hour from units per hour. And I'll show you what I mean by that. And then with the APTT, whatever the APTT is, then you're going to look in the boxed section here and then just fall in the category. So it says APTT of 43 seconds. So it says 43 seconds here. And so I'm just going to look at which one of these does 43 seconds fall into, and that would be step 12 of the protocol. Okay. The other part of the protocol is actually, it's stated here initially, and it's restated number 10. Number 10 says bolus with 80 units per kilogram. So someone asked earlier, how do I know when to account for the patient's weight? That per kilogram tells you to account for the patient's weight. And then it says to start the drip at 18 units per kilogram per hour. Now, don't get hung up on this thing where it says drip, right? Because drip, typically you would think drops per minute, but here we're going to be calculating units per hour, milliliters per hour. Okay, so don't get hung up on that detail. So let's go ahead and work through this initial scenario. Okay, so first and foremost, we need to identify that the patient's weight is 110 pounds. Okay, I'm going to convert that by dividing by 2.2 to kilograms, and I'm going to get 50 kilograms. Okay, so far so good, right? So I'm just going to confirm my thing here. Okay, 50 kilograms. Now on your test, if you get a patient's weight and it's not a whole number, meaning it's not 50 or 40 or whatever, if it's 50.232323 or whatever, round to the nearest tenth at this step. Okay, please, please, please don't forget to round at this step and then continue on with your calculations. That may not be 100% accurate when we're talking about in real life, but there's real life protocols that are a little bit different than what we're doing here in the dosage calc math protocol. Okay, so 50 kilograms. The first question states, sorry. The first question says to calculate the number of milliliters to administer for the bolus. So what I'm going to do is I have 50 kilograms and it tells me to bolus with 80 units per kilogram. So I'm just going to do that the next thing. So once I've figured out how many kilograms I need, I'm going to do my bolus of 80 units per kilogram. Okay. So when I do that, I'm going to get 2,000 units. Right? So I'm just going to double check 50 times 80. Oh, I'm sorry. It's 4,000 units. Helpful to have your calculator ready to rock and roll. Okay. So 4,000 units. I apologize for the sloppiness of this, but 4,000 units. Now the question says we need to calculate the number of milliliters. If it said calculate the number of units, we'd be done. But I need to calculate the number of milliliters. So I have 4,000 units. I need to convert that 4,000 units to milliliters. Is there a way for me to do that? And the answer to that is yes, it's in the protocol. So when I go back to the protocol, so remember 10 tells us what to do. Bolus with 80 units per kilogram, start a drip rate at 18 units per kilogram per hour. Right now, we're just focusing on the bolus. And the reason we're just focusing on the bolus is because we're working through question A, which says calculate the number of milliliters to administer for the bolus. So right now, all I care about is bolus. Bolus, bolus, bolus. Okay. So I'm going to go back up to step 2 of the protocol. And step 2 of the protocol, the second sentence says bolus dosage strength 1,000 units per milliliter. Can I use that information to convert units to milliliter? And the answer to that is yes. I'm going to take my 4,000 units. I don't want units. I want milliliters. I know that my bolus dosage strength is 1,000 units per milliliter. I'm going to eliminate units. I'm going to be left with what I'm looking for. So the answer for A is 4 milliliters. So as a recap, how did we solve this? Step 1, patient's weight in pounds divided by 2.2 gives me 50 kilograms. I'm going to multiply that 50 kilograms by what it tells me to in step 10, which is to bolus with 80 units per kilogram. So 50 times 80 gave me 4,000 units. 4,000 units is not what I'm looking for. I need to know how many milliliters to administer. So the 4,000 units times the bolus dosage strength, which in step 2 of the protocol tells me 1,000 units per milliliter. So I don't want units. So I divide by units. So 4,000 divided by 1,000, and I get 4 milliliters as my bolus dosage strength. Okay. Now, part B. Now we're going to do a drop rate. Same patient, same weight, 50 kilograms times, it tells me that I'm going back to step 10. And this is also, remember, the same information is listed at the very top of the protocol as well. So it's repeated. Start drip at 18 units per kilogram per hour. units per kilogram hour. Again, I like dimensional analysis from a teaching perspective because then I can easily show you how I'm getting rid of units and how I'm transitioning and going into where we want to be going. Okay, so 50 times 18, I believe that's 900. 900 units per hour. Now, where did we see units per hour previously? Well, we had to do the conversion in question 22, I believe it was, or 22 and 23, where we converted units per hour to milliliters per hour. So that's exactly what we're going to do. We're going to do the same thing. We're going to convert units per hour to milliliters per hour. So again, in order to do that, I need to know how much heparin I have and then how much IV solution I have. Because if you think about it, when we're calculating an infusion rate, there's an IV bag present, right? Could you imagine someone just sitting there with a syringe and just pushing, a medication like every hour, but standing there and doing it slowly so that you get the exact amount? No, you got the technology to do that. And so that's what we're utilizing. So it says here that heparin, 25,000 units in 250 milliliters, half normal saline. So that's what I'm going to use to convert units to milliliters. Now, you may be asking, well, why don't we use the bolus dosage strength? Because we're not calculating the bolus dose. The bolus dose is a separate syringe, okay? It's a push. It's going into the port and it's getting pushed in while they're attached always to this 250 milliliter half normal saline. Okay. Now, in reality, this is they probably have, their normal saline IV, like a 500 milliliter or 1,000 milliliter bag. Then this is a piggyback bag in order to infuse the heparin in. And then these are where you're injecting right into the port. Okay. Now, if I'm saying anything wrong, just keep in mind, I am not a nurse. And so I'm just postulating how this whole process works. So if some of you are going like, oh, you're doing a pretty good job, then I'm pretty good at guessing. Okay. My main focus is I can show you the math. Okay, guys. All right. All right. So we already did this step, starting the drip at 18 units per kilogram per hour. Now we need to convert units per hour to milliliters per hour. So I'm going to take, I don't want units. I want milliliters. I have 25,000 units of heparin, and then in a 250 milliliter IV bag. Now I'm going to give you a little shortcut because I've been doing this for a couple of years now. If this ratio right here is the same thing as 1/100, okay? So because these are all done exactly the same way, that's just a little bit of a shortcut. But if you ever get stuck, just follow with what is written in the protocol so you don't get stuck. Okay. So what I'm going to do is I'm going to do 900 times 250 divided by 25,000. And then what I'm going to get is 9 milliliters per hour. Sorry for the creepy stare from my microbiology book there. So, are there any questions on how to solve or where I'm getting the information from for parts A and parts B? Okay, so the other thing is you'll notice that I set this up. I did this and then I did a separate line. A lot of it is just because I knew I was going to run out of space. Whereas here I just did it all one line. Okay. There's no one right way to do that. I could have easily taken that 900 units, brought it down here, and then did this same multiplication right here. I just did that because that's just what I decided to do. Okay. If you prefer to split it up, that's perfectly fine. And that's one of the reasons why I'm setting it up the way I am setting it up.
I have a question. Do you have a more simplified way to do this?
Unfortunately, there is no simple way to go through this. I can tell you that from doing this, I know that all I would do, like, because I've done this so many times, is I would take the patient's weight in kilograms, find out the kilogram per hour, divide by 1,000. I would then find it, take that same patient's weight, multiply by 18, and then divide by 100. So that's how I would do it the easy way, because that's the way it works every single time.
So you said after 18, you divided by 100?
Correct.
Okay, perfect.
Yeah, so like if I was going to do this the short way, this is what I have, because I've done this question so many times. I would take the patient's weight times the 80, and then I would divide all that by 1,000. That would answer A. And then B, I would take the patient's weight times the 18 and divide it by 100. Okay, because every single time it works that way, at least for these questions, as long as you have the patient's weight accurately. And then you can double check. I'm actually going to double check my work and make sure I didn't tell you anything wrong. So 50 times 80 is 4,000 divided by 1,000. You get 4 ml.
Mm-hmm.
And then 50 times 18 divided by 100, you'll get 9. So that would, since you asked for the bare bones, simple way, this is how this would work. So the only thing you would need to change, given this, okay, this is worth the price of the emission, which was free, right? All you would need to do is change this number for the original bolus and the original heparin drip, okay? Is the patient's weight would just be different.
I see. Well, this makes a little bit more sense.
Sure.
Thank you. I appreciate it.
Yeah, you're welcome.
Dr. Rad.
Yes, sir.
So the 80 and the 18 and the 1,000 and the 100, they never change?
Correct. Because we're always going to use the 250 for 225,000 and the 1/1,000, because like I said, if you Google Heparin Protocol, you're going to see exactly what I have written here. All I did was copy and paste this from Google. So I mean, I found like where this was posted a number of times, and I just copied and pasted it and then redistributed it. So that's all it is. That's the Heparin Protocol. So those numbers will always be the same.
Thank you.
You're welcome. And that'll be helpful, because while you guys are like, practicing these, if I show you that shortcut, and if you get it the long way and you get it the very, very short way, then at least you know you're doing it right. Now for C,
unit straight up, I guess.
Yeah, exactly. And then it'll be, you can start off with like, okay, he said to do this, let's try this. Okay, I got this. Now let me just make sure everything works out, and then that way you can practice it. So now when you do C part 1 and 2, that could change. So I'm going to show you what the practice test shows. So that there's not a one well-defined way like this for part C, just because it will depend on what the APTT is, but I will show you what it is based off of the practice test. All right, so C says after 6 hours, the patient has an APTT of 43 seconds. So what I'm going to do is I'm going to go to the APTT and then the range for 43 seconds, and then I'm going to see what it tells me. it tells me to rebolus with 40 units per kilogram, and then to increase the rate by 2 units per kilogram per hour. Okay, so it tells me something new to do. Now the bolus, what is 40 units per kilogram? Well, it's exactly half of 80 units per kilogram, right? So without doing any math, your new bolus is 2 milliliters, okay? Because it's exactly half of where we started. But I do need to do a little bit of math to make sure that I get the correct IV drip. And then, of course, they want you to show that work anyways. So let's work through that. So for C1, I'm going to take the same patient's weight, and I'm just going to show you the workup just because it's helpful. Okay, the same patient's weight. Now the setup tells me, it tells me to rebolus with 40 units per kilogram. So I'm going to multiply now by 40 units per kilogram. Okay. Then when I get my answer, it's going to be 2,000 units. So kilograms are gone. I don't want units. I want milliliters, right? Because one of the first things it says is calculate the number of milliliters to prepare. So it's supposed to be for the bolus. I didn't write that in. So I'm going to use the same bolus dosage strength because that's the only bolus dosage strength we have to work with, which is the 1,000 units per milliliter. Okay. And then you'll get 2 milliliters as your answer. So if I was going to do C1 per the practice, 50 times 40 divided by 1,000. Notice that every time we do the bolus, we're doing dividing by 1,000. Okay, so that seems to be the constant, is dividing whatever you get in units by 1,000 in the Heparin protocol for the bolus dosage strength. So that's C1 would be the 2 milliliters. Now C2 tells us to do something different. So we still have the same patient's weight, but it says we're going to increase the rate by 2 units per kilogram per hour. What was our initial rate? Our initial rate was 18 units per kilogram per hour. So instead of 18 times 50, now we're going to increase that by 2. So we're going to do 20 units kilogram hour. Okay. Then you get 1,000 units per hour. I don't want units per hour, I want milliliters per hour. So I'm going to use the exact same thing that I used up here, the 250 milliliter per 25,000 units. Why? Because that's the only thing I have attached to this patient. We didn't reattach a new or different IV bag to them. We're using the same setup that is listed in the protocol. So I'm going to take the 250 ml, the 25,000 units, and I'm going to get 10 milliliters per hour. And so the short for C2 would be taking the patient's weight times 20 this time, divided by 1,000, or by 100, I'm sorry. And notice that for the drip, we're going to use divide by 100 every single time. Okay, so I put in this little section here. This is kind of like your shortcut for this practice. Now, A and B will be the same because that's your starting. A and B will always be the same. Okay, C1 and C2, however, that will be dependent on the APTT. So if you're following step 12, just going to write step 12. Okay. Step 12 for C1 and C2 with the APTT of 43 seconds, or the range is 36 to 44 seconds, then that's what you would use. If you did step 11, it says to rebolus with 80 units per kilogram and then to increase the unit by 4. So instead of 20, this would be 22. If you're APTT for step 13, you would just continue the current rate. So you wouldn't do a bolus. You would just do the current rate, which was what you had here, 50 times 18. And then if it's step 14, you're going to decrease the rate by 2. So you started at 18, so it becomes 50 times 16, and then no rebolus. And then the last one, step 15, it says to hold heparin for an hour, meaning take them off the heparin, and then to decrease the rate by 3. So you would go from 18 units per kilogram per hour to 15 units per kilogram per hour, and then recalculate the bolus dosage strength based off of that. But most likely on your test, you're going to get either A and B, or you're going to get basically following step 12, because it has you do a new bolus and a new heparin drip. So I will be back for your section this evening from 5 to 6. I will also be back for your section on Thursday at 1:15 to 2:15, and then again from 5 to 6. If you have any questions, email them to my email address, and I'll write that down here real quick. And then I will address them. I don't even know if this is going to show up good.
Dr. Raz,
Yes.
can you tell me why we didn't round on 1 and 2?
Oh, yeah. So you do not round basic conversions when you're staying within the same units. So like if you go from milligrams to grams or micrograms to milligrams, do not round. The only time you're going to round is if you go from like going from pounds to kilograms, round to the nearest 10th. Going from milliliters to ounces, round to the nearest 10th.
But you don't round if you're going from like a milligram to a gram.
Correct. Do not round those.
Because those are different?
Correct.
Okay. And you wouldn't, but a liter and a milliliter, they're the same?
Right. They're in the same units. So like a liter is 1, and then a milliliter is 1,000 liters, right? So you're just going to, you would not round when you are in the same unit family, basically. So like when you're going from milliliters to liters, liters to milliliters, don't round. When you're going from milligrams to grams or milligrams to micrograms, don't round.
No, because you're switching family.
Correct. They want you to write it out like, and like you said, yeah, you're staying within the same family of measurement, the metric system.
Yeah.
But when you go from metric to US standard or vice versa, like pounds to kilograms, round to the nearest 10th.
Okay. Thank you.
Yeah, you're welcome. All right, guys. If you have any other questions, just like I said, email them to me. I'll be back at 5 o'clock for you guys.
Okay, sorry, your email is there C before Z? Can you hear me?
I posted my email in the chat, so you'll see it there.
Oh, okay, thank you.
You're welcome. Sorry about that.